So you and I have something we need to deal with here today. Now, if I told you there was a disease that affected more than 10% of kids, totally preventable, and something so malignant that it breaks immune systems, changes brain development, and shortens lives, you'd probably think that doctors and teachers, parents and government officials were working on it 24 hours a day. Because that's what you do in a public health crisis. But they're not. Why? Because we don't know about it, and we're not asking about it. We're going to get into some tough stuff today. I'm going to talk to you about protecting children and what we can do with data. So, we estimate 12% of kids in Hong Kong suffer from some kind of sexual abuse before they hit 18. We also estimate that 96% of it is unreported. So that means in a room this size, probably 1,000 people, there's likely 120 of us survivors. It means you know many survivors. It even means you probably know an abuser. And that's hard to think about. I know it is. But we have to, because we can't just keep asking kids to protect themselves. And that's basically all we do right now. I want to tell you a little bit about my story. I'm an incest survivor. My father raped me from 10 to 14. And when I left home, I just shut that door and I didn't look through it again until my mid-40s, and we'll get to that in a minute. Did I tell anyone back then? No, I didn't. I stayed silent. Parents in the room may think that they would know if that was happening to their child. It's really common that they don't know. So why didn't I tell? Because my father told me that's what love is. And love is what kids want most. And removing it is a powerful threat. So the reason I'm telling you my story is because I want you to know how common it is. It's a story that I hear over and over again from women who arrive at our support group. So it's more common than you may think, but check this out. The Social Welfare Department only records about 300 cases a year, and that's not very many in a city our size. In fact, last year, the police department only recorded a single case of incest. It's hard to tell. And for a lot of survivors, it takes them years to tell friends, never mind the police. And that's, again, why you and I have to make it a public conversation. So, we have this public health crisis. It's 12% of kids. If we want to prevent it, what should we be doing? I mean, we should be figuring the basic stuff out, right? We should be figuring out who is vulnerable and making specific plans to prevent it. So we should know who it happens to, how old they are, who did it, where they did it. But this data is not from Hong Kong. This is from the CSA Center in the UK. Here, we know very little of this. We don't track it. It doesn't mean it's happening less here. It just means that you know it. You don't know it. There are no dashboards that show trends over time. You can't analyze it and pull out key indicators that would help us identify and prevent abuse. The departments involved only collect a little bit of data. They don't even use the same categories of abuse or even the same age of a child. Is it somebody under 17 or under 16? And my goal is to change that. So Talk Hong Kong's first ever report pulls together all the data that we could to get a good picture of what we know about abuse in Hong Kong. We worked with Hong Kong U lawyers, we worked with a prevalence expert, and we looked at the last 10 years of official data. And here's some of the stuff we do know. We estimate 12% of kids in Hong Kong suffer from some kind of abuse. And that's a number you'd see in the US, UK, Australia, unfortunately. We also estimate it's 96% unreported. So that means if this red circle are the cases that we do know about, the rest of this whole room are cases that we do not know about. 72% of kids in reported cases knew their abuser. We can also tell it's a gendered crime. So 85% of the known victims are girls, and 93% of the known perpetrators are boys and men. So there's a lot of stuff we couldn't tell you, and here's why. The gaps in the data are huge. I'll give you a simple example here. So the police department and the Department of Justice do not record the age of the victim. The gender of the victim. But the Department of Justice also does not record the age of the victim. They could be 13 or 33. It's very hard to tell. And a lot of departments who are involved with abuse don't have the data available to analyze at all. And that's the Hospital Authority, the Education Bureau, and the Correctional Services Department. What does it mean that all this information is missing? I mean, it means the obvious stuff, that cases that enter the system can't be analyzed and learned from. But what it really means is that we don't know who is vulnerable. I can't tell you girls 8 to 10 in TST are more vulnerable at home. And that's the kind of precise information we need to start making plans for prevention that work. For kids, what it means is that they're likely to experience chronic health issues, mental illness, suicidality, substance addiction, and shortened lifespans. And that is the long-lasting tragedy that complex PTSD is, that goes long beyond the abuse itself. And it's what we want to prevent. So, we need what the CSA Center in the UK does. We can see that the data they have and the programs they offer give departments and protection professionals the information they need to make the policies and the protection plans that will protect children. So, while we're working on improving the systems that will protect children, I have some stuff that everybody in this room can do, and you can do it today. First, for the parents in the room, I want you to ask every organization that has contact with your child, and here I'm talking about schools and tutors and coaches and doctors' offices and community centers, what is their child protection program? I don't just mean what are they teaching kids, I mean how are they handling the adults in their organization? And read the report. I would love to tell you a long list of research on Hong Kong situation, but there simply isn't. Next, get yourself some training about how to interrupt and prevent abuse. Everybody can do this. You don't need to be a parent or a teacher. Every human can do this. It's online, very reasonably priced, available immediately. Don't force affection on kids. They don't owe you a hug, not even on the holidays. And maybe the most important thing, tell 5 people what we talked about today. That's how we're going to start the conversation. Short and sweet, thank you for being here and listening to a really, really hard topic. It's been incredible for me, and I want to leave you with one final question. Who is silence helping?